Hi, everybody. Brianna here with Nurse Deck for another installment of our interview series. As you know, Nurse Deck is built by nurses for nurses, and we aim to provide a collaborative social space for nurses across all levels to share resources and guides, camaraderie, humor, work-life sanity savers. And today we are joined by Dr. Angel Daniels. She is a post-licensure and general education program chair at Secours Memorial College of Nursing. Dr. Daniels has a strong background in management and healthcare systems. She is an advocate for population health strategies for patients in and out of hospital settings, as well as nurses transitioning from education to practice. So welcome. Thank you for joining us this morning. We really appreciate you giving your time to us.
Thank you. It is my pleasure to be here today. I'm so excited to be here and share my story and ready to go.
Awesome. Well, let's start at the beginning.
Okay.
Tell us how you got your start in nursing.
Oh, wow. So I'm a nurturer by nature. Ever since I was a little girl, I've been called to serve others and care for others. I remember as a child, I would play with my dolls. I would go and get my mom's sheets and cut them up and get in trouble, mind you. But, just give them pretend medicine, put some bandages on them. So early in life, it was a calling for me. Also, as a child growing up, I grew up in the east end of Richmond, Virginia, where we had a lot of determinants even then. So I watched a lot of my family members not receiving good health care, particularly my grandmother. She was sick. She had emphysema. And at the hospital that she was in at that time, she was in ICU and she was intubated and restrained, and they did not even have her sedated.
God.
She was living through that time that, she had to endure all of this conscious.
Right.
She ended up having a tracheotomy. And then it was, she looked at me one day and she just said, "Angel, help me." Oh. And, I was barely 20 years old and I felt helpless.
Yeah.
But she had one nurse that came into her room, and I saw this woman take care of my grandmother like she was her own family. And that inspired me I said, yes, I'm going to do this. I'm going to become a nurse. And it was something I meant I was going to do. I was inspired, and I just decided there was nothing going to stop me from achieving that goal.
Yeah, I love that. That gave me goosebumps. That's a very sweet and heartbreaking story. And I think so many nurses can relate to that one nurse that sticks out and you're like, wow, you see the impact they have on, your own family members or yourself. And I love hearing stories like that. Can you tell us a little bit more? I know you have your doctorate.
Yes.
Amazing. Congratulations
Thank you.
on that. Can you tell us a little bit more about your journey, how you were able to achieve such an amazing level of education?
Well, it wasn't an easy journey. I attended nursing school when I was in my 30s. I grew up the youngest of three. I dropped out of high school when I was 15 years old. I was a teen mom. I even did some tenure as a cosmetologist. So I struggled. I was a mother of two by the time I was 19, and then a third child. So by the time I decided to go into nursing, I had to go back and take high school courses. I had, and it was very hard. After I got into nursing school, I still worked full time. I went to nurse school at night, and on the weekends I had clinicals. 3 kids at home, living off of 2.5 to 3 hours of sleep for almost 2.5 years.
Wow.
So I was dedicated to becoming a nurse and achieving a goal. When I graduated nursing school, I went straight into the ER. But one thing about Angel, I never want to stop learning. Once I got that taste of it, it was like, I need to know more.
Yeah.
I became a case manager, then a nurse navigator. And at that time, I went on to get my bachelor's, earned a master's in nursing education. And still, I needed to have more to fulfill myself and lead change. And that's when I decided to pursue my DNP degree
Yeah.
in healthcare system management. As a nurse navigator and clinical transformation manager, I saw so many opportunities to provide quality care to patients beyond the walls of the
Yeah.
hospital,
Right.
outside, because when we get our patients in the hospital, they don't start there. They start in their own communities.
Right.
And if we can coordinate resources and if we can coordinate things that would help them in their own management and self-management of
Right.
their care, by the time we get them in the hospital, it's more manageable.
Right.
So for me, struggling to get to that level, it takes a lot of, why am I doing this?
Mm-hmm.
What does this mean for me? Not just to have alphabets behind my name, but
Right.
also, what am I getting out of all of this learning? And
Right. Right.
how can I put that into work as
Yes.
a nurse, as a leader, as an educator? And how can I be a part of that innovation to keep healthcare delivery as it evolves
Right.
high in quality?
Yes. Yeah, I think that's such a good point because so much of healthcare right now is reaction based, I'm also of the ER, so we see the merry-go-round of people that just don't have services when they leave the hospital setting. So
Yes.
to be someone that sees that as a area that nursing led leadership can really impact is it's such a needed aspect of healthcare right now. That's amazing. What area of nursing right now are you most passionate about?
Oh, that's such a trick question.
I know, right?
I am very passionate about women's health, particularly minority health. Um, and I think that I go back to my ER days because I was blessed to have the opportunity to serve in an ER that served a very diverse population of underrepresented populations that came to our ER for more chronic
Yeah.
care than they did for emergent care. So I got a full scope of, what I was looking at in the patient population. So women's health to me has always been my passion. As a woman myself, I want to make sure that we have what we need as resources to take care of our minds, our bodies, so we as women can keep thriving. But I also am really passionate about health equity. Um, I think that everyone should have the resources they need to be their best health, their best selves, have a true health and well-being, and not just physical, but mental health as well.
Yeah.
And that is what keeps me going, that equity piece. I would love to do more work in health equity.
Yeah. Love that. That's also another huge area of nursing that I think nurses could just make such an impact in as well. You spoke about being a young mom, going back to school. I feel like you've probably got a pretty good handle on how do you balance really intense situations. Being a single parent, super intense, being a lifelong learner, super intense, and working full time. How do you find balance now, and especially related to women's health? Because I think women take on so much, and we're often the last ones on the list to care for. So how do you personally find balance with all of that?
So for me personally, to find balance, every day I remind myself of why I do what I do. I look at what's important to me. Of course, my job is important to me. My family is important to me. And I look at how can I be that all to every part of my life.
Right.
I look at what's the immediate need in the moment. I can't worry about what happened yesterday. I don't know what's coming tomorrow yet.
Yeah.
But what do I need to focus on and be prepared today? And if necessary, then I start to look at what I need to do for tomorrow.
Yeah.
I think every day I take a good 15 minutes of just having some quiet time for myself. And I think that's important. It comes to play in a lot of the questions that, we're going to discuss. But if we do not take the time to find that balance, take care of ourselves,
Mm-hmm.
We can't do anything else. We can't take care of others. We can't be there for our families or our patients. So self care, if it's only 5 minutes, go outside, take two
Mm-hmm.
minutes to breathe and clear your mind.
Yeah.
Because we as women, we like to do everything for everyone,
Yes, we do.
and we as nurses, male, female, um, we all want to serve others. We all want to take care of the people that we care about, but we can't do that if we do not take care of ourselves. And
Yeah.
so for me, that balance comes from just prioritizing what's important to me in the moment
Mhm.
and
Yeah.
how I can achieve that without
Yeah.
burning myself out.
Right. Well said. Well said. I noticed one of your publications that jumped out to me. You wrote about the return on investment with BSN educated nurses in ambulatory care. Can you tell us a little bit more about that?
Yes, I was a co-author on that publication, and what that really speaks to is the use of RNs in the ambulatory care environment. So, primary care specialties such as cardiology or endocrinology, whatever the area may be, but it's using a higher paid workforce in an
Hmm.
environment that normally you would use other disciplines for.
Right.
And for us, what we did was we used the RNs as nurse navigators, helping
Mm.
to navigate patients through the healthcare system, again,
Hmm.
beyond the walls of the acute care setting. And what that does is more population health management, it's more case management,
Hmm.
more coordination of care and resources
Yeah.
that really help our providers also manage the quality of care better, helps
Yeah.
our patients get to
Hmm.
move towards self-care,
Hmm.
and also it reduces that ED utilization, hospital admissions,
Yes.
reduces some of the states of the chronic conditions,
Right.
increasing, wellness visits, especially for Medicare, which is a reimbursable visit. And for that, the return on investment is investing in that higher workforce,
Right.
letting our RNs work to the full scope of their practice and
Yes.
beyond to help manage our patient populations.
Yes. It's makes too much sense. I love it.
And we actually started off with, one or two nurse navigators, and we had so much pushback from the doctors. Like, we don't need them. We don't want these RNs in our practice. We can take that money. Let's distribute it other places. And after we put those nurses in the practice, let me tell you, we had
Yeah.
physicians. Where is my navigator?
Yes.
I want my navigator. Because
Right.
they saw the increase in compliance with our quality metrics. They
Right.
saw the decrease in the ED utilizations. Patient adherence was going up. I mean, they were
Right.
coming in for their visits, they were taking their medications. And
Yeah.
we even found innovative ways to help manage these patients. At one practice where I was a navigator myself, we had a diabetes clinic day where
Hmm.
we would bring all our diabetic patients in. They would get cooking classes. They would see the doctors. They would see the
Yeah.
ophthalmologists, podiatrists. And we even made a deal with one of our local pharmacies where we had bundled medications of all their diabetic medications. And
Yes.
they would get it for $20.
Wow.
And the compliance over a short 6 months, we increased compliance and the A1Cs improved at least 7%.
Wow. Wow. That's huge.
So that's the return, investing in that workforce, is the return
Yeah.
on investment.
Yeah. I mean, it's such a natural role for a nurse to be in because we're so holistically minded anyway.
Hmm.
And I think nurses also do really well at seeing the big picture because we follow patients along their timeline, in and out of the hospital settings.
Yes.
Whereas physicians are kind of limited to that 15-minute snapshot, next, 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 next. So,
Hmm.
I mean, it's such a perfect role for nurses, really. Um, and like
And
you said, oh,
I'm
go ahead.
sorry, we do
I was
have
going
that level of licensure that we can follow algorithms and protocols just like we do in the hospital, that we can follow
exactly.
in ambulatory. And that also helps the physician, with
Yes.
managing the patients and ordering tests that, they don't have time for, and we can do that
Right.
for them.
Yeah. Do you find nurses are, I don't want to say surprised, but to see the extent that the scope of their practice covers?
I don't think they're surprised. I think they are more fulfilled that it's
Yeah.
happening.
Okay.
Because
Yeah.
this is something I feel like, I know me as a nurse, always wanted to do more.
Right.
But in certain, disciplines or areas that you work in, you may find that there's some limitation.
Yeah.
There's more I hate to say the word robotic type. I have to do this,
Right.
more skilled
Yeah.
focus. But we can go beyond that. We are
Hmm.
trained to go beyond that.
Yes. Right. Yeah, we absolutely are. And it's such a good utilization of, like you said, the upper limits of the scope of your practice. Um, let's switch gears a little bit. I want to talk about, as an educator yourself, what academic challenges have you seen in nursing education over the past, what are we at now? 18, 20 months of the COVID pandemic.
I think for me, what I've seen, is particularly at my College of Nursing, is everyone adapting to the change of learning and teaching in a
Mm,
different capacity. I also think that incorporating how our students and faculty are experiencing determinants from COVID. You have people with sick families, you have nurses who, for my program, which is post licensure, professional RNs trying to balance the shifts and demands of their, schedules in the hospitals, their family,
hmm.
seeing loved ones sick, losing family or patients, and then trying to
Right.
juggle finishing school.
Yeah.
Um, we have a lot of experienced educators who teach online. So an online environment from that piece was not hard. But what we
Hmm.
had to do was adapt our didactic in-person
Right.
courses into online. And that took a lot of, change for some of
Yeah.
our faculty members. How do you teach, the bed and bath online? How do you teach basic
Right.
clinical concepts that you would do? So
Right.
we started doing beyond the lecture. We started doing more recordings. We started having synchronous class time,
Mm,
virtual simulations when we could not
hmm.
go into the clinical areas. So I can say that for us, I mean, it was a change for some faculty, but they were so dedicated that they did an amazing
Right.
job of
Yeah.
adapting to that. For the students, it was hard. It's hard for some learners to not have that hands-on piece.
Hmm.
So you have to factor all of that into change. You
Right.
have your auditory learners, but you have your hands-on learner, your visual learner. How do you do that in an online environment?
Right.
And
Yeah.
it was a struggle, but I can also say that we were able to maintain at least a 95% in-class pass rate
Oh,
with
wow.
our COVID graduates.
That's amazing.
So
Yeah.
it a lot of hard work.
Yes, I can imagine. It puts a lot of stress on both the educators and the students, like you said. So,
But what we
um,
also saw was a lot of students had, mental burnout
yeah.
from COVID, um, some depression, a lot of things. So we had a lot of resources built in, our success advisors. But you also have students who develop relationships with their faculty members when you
Mm,
feel comfortable. I have a lot of students who come to me and just need to talk
yeah.
about personal things. A lot of students would come to me and I would share my story. And even though my story wasn't in the time of COVID, it
Right.
still was a time of struggle.
Right.
And we talk about it and talk it through. And sometimes that's all people need, someone to
Hmm.
listen, and they can
Yeah.
help figure out how to manage it.
Yeah. Yeah. And I think, I mean, I would argue those hard and vulnerable conversations are still training for your future rapport building with your patients that are also going to be going through their own struggles, you know?
Absolutely, yes.
Yeah. Let's talk about your experience as a nurse manager,
Mhm.
the impact of the pandemic to our nurses and on the quality of healthcare that we were able to deliver. Shortages of PPE and staffing issues and surges after surges after surges. How do you see this affecting nurses' wellness overall?
I think nurses are exhausted. I
Yeah.
think, and that's an understatement. A lot of burnout, mental, physical burnout. but I also see that nurses have done an amazing job of taking care of patients and maintaining that quality. I mean, I've
Mhm.
seen innovation. So nurses, at some of the local hospitals found ways to record messages and put them into teddy bears and give them to
I
the
saw that
families.
too. Yeah.
Yes, and I'm like, that
Amazing.
is amazing. And I
Yeah.
think for us as nurses, that's what we do.
Yeah.
We find innovative and creative ways to still manage to deliver that quality care
Right.
and also compassionate care.
Yeah.
Still, striving to take care of their patients just as if they were their loved ones, just like that
Yeah.
one nurse that inspired me.
Yeah.
Um, and I think it's hard, but I also think for nurses, it's opportune time that the value of nursing is being seen.
Mm-hmm.
I see that some health systems now, are increasing pay rates and offering
Mm-hmm.
more bonuses, and I think it's well deserved. I mean,
Mm-hmm.
it's just something that shouldn't take COVID to
Right.
evaluate, you
Right.
know, the value of a nurse. I think that also, we have to find a way. We keep trying to recruit and recruit, but how
Mm-hmm.
can we retain these
Right.
quality nurses that we have?
Yes.
And that's a pet peeve of mine. We're being asked to produce more nurses. Well, we need more nurses. Okay, we're giving them to you, but how can we retain
Right.
them? Not just the
Right.
new nurses, but these quality nurses we have that have been in practice for
Right.
years.
Yes.
What can we do to keep them and show them, hey, you mean so much to us. We need
Right.
you.
Yes.
And I think, the staffing shortage is going to get worse, to be
Mm-hmm.
honest, because some people that I know personally as nurses, they've either used COVID to say, hey, this is why I became a nurse.
Mm-hmm.
And then I've heard some said, I don't know, I'm starting to rethink if nursing is for me.
Yeah. Yep.
It's a plus and a minus there.
Yeah.
But I'm truly concerned about the burnout, the demand, and shifts that some nurses have to work, and it is a cause for concern. And it goes back to finding that piece of self care.
Mm-hmm.
But I would also say to nurses, you have to find that area that makes you happy,
Mm-hmm.
whatever that may be,
Right.
and your true value
Mm-hmm.
to what you're doing.
Yes. Right. I know it's a delicate balance between encouraging nurses to advocate for themselves and
Mhm.
not be taken advantage of and say no to overtime shifts if you're literally existing on coffee and fumes. But at
Mhm.
the same time, we want to keep you, don't leave us entirely. Just take a break.
Exactly.
But come back,
Exactly.
please.
Yes.
Yeah, that's the dance that I think a lot of nurses are on the edge with right now. Um, where do you see the future of healthcare from a nursing perspective if we ever get into a post-COVID, hopefully finger everything crossed, or just living with COVID world?
I think COVID is always going to be some type of memory with us. Some
Yeah.
way it's going to be a learning experience, and I hope someday we'll be in a post-COVID world.
Hmm.
I talked about the nursing shortage. It's inevitable. I think it's still as our patients continue to even grow older, as they continue to be sicker.
Hmm.
Healthcare delivery is going to keep evolving to manage those patient populations, and I
Right.
think we as nurses continue to evolve with them. I do feel like the future is really going to look at health equity, my
Hmm.
area of passion. I think we need more diversity, equity, and inclusivity in nursing, even in nursing education, which
Hmm.
is another big area that I'm very passionate about
Right.
and that I have done some presentations on recently regarding the nursing shortage. We
Yeah.
need a more diverse workforce
Yes.
because our patient populations do want to see nurses that look like them,
Yeah.
that can relate to them.
Hmm.
And I don't know, it's a big struggle there.
Yeah.
Recruiting more diversity and inclusivity in nursing education.
Hmm.
Um, I don't know the answer to that piece, but I do know we need to make change.
Yeah.
There needs to be more dedication to, again, not just recruitment but retention
Hmm.
of all nurse faculty,
Yeah.
create an environment of inclusivity,
Hmm.
um, being very being very explicit in our language,
Hmm.
um, and what we need and the statements that we have to draw
Hmm.
attention to our healthcare workforce and our patient populations.
Right.
I think that overall for nursing, we're going to continue to thrive.
Hmm.
We are a population of lifelong learners,
Hmm.
um, and we also are agents of change.
Yes. Yep. I agree. Now, you are someone that designs curriculum, correct?
I do, yes.
Do you feel like I feel like when I was in nursing school 15 years ago, there, diversity and inclusion and health equity was like a one paragraph blip in a textbook that also talked about cultural competence.
Hmm.
Um, and it was pretty much aimed at like, if you get this question on the NCLEX, here's how you answer it. It was not a evolution of healthcare systems that it needed to be. Do you feel like nursing curriculum now is taking a more comprehensive look at that, or a critical eye on that, and helping students to involve them in, their ideas and their impressions of how to change the workforce to reflect, as you said, the patient populations that they serve?
I think that in the time of now, it's starting to happen.
Yeah.
I'm hearing more conversations, and I'm a part of more communities that's really looking at diversity, equity, and inclusion in nursing
Yeah.
education. When I first started full time as a nurse educator, I was asked to revise the population health course, to be a part of that.
Hmm.
And, you know, not just the cultural competence piece, but we need to look at every patient population. We need
Yes.
to look at
Right.
the needs beyond taking care of our patients at the bedside.
Right.
And what are social determinants? That was a big thing that I
Yeah.
introduced in my course. What are social determinants of health, and how do these factors play a role into how
Hmm.
patients take care of themselves? Because
Right.
if you have patients who either have to choose between paying their light bill or
Right.
their rent
Yeah.
over buying medications, they're going to pay their light bill and their
Right.
rent. Or if they
Absolutely.
have to buy food, or if they live somewhere in a food desert, or places where they can't afford to get more healthier options. Well,
Yeah.
if I have $20, I guess I have to go to Wendy's and get the dollar menu for all six of my family members.
Right.
But also incorporating more service learning opportunities where they can go to more diverse community settings and
Hmm.
learn more about patient populations.
Yeah.
I remember taking a group of students to one of our the hospital I worked at in the ER, which is in the center again of a very diverse population setting, where they, suffer from different social economic struggles and social determinants. And one of my students, when she got there, she said, you know, is it okay to park here? Because is it safe? I don't feel like I'm safe.
Mm.
They were scared to be at this hospital,
Wow. Yeah.
and they were scared to work with the patient population,
Wow.
because that area, it was more a minority of African American patients.
Mm.
However, upon leaving that clinical experience and going back a few times, they loved it.
Mm.
They were so they said, I love feeling like I'm able to help this patient population.
Yes.
I
Yeah.
love understanding more, they said, because they had bias.
Right.
And
Yeah.
truth be told, we all have a bias about something. If you're
Of course.
human, you have a bias.
Hmm.
But some of them that implicit bias, they had biases that they did not know they
Hmm.
had until they came to that hospital. Still, they start working.
Yes.
They had the impression that people who didn't take care of themselves, or people who just went to the ER with for something minor, were just lazy, or
Right.
just using the system. And then they learned that was not the case.
Yeah. Such a huge problem. I feel like in
Hmm.
the ER.
But I also do feel like NCLEX, and this is my perspective, has not caught up with population health and
Hmm.
diversity yet.
Right.
There's still a lot of epidemiology focus, community focus, but our population health management focus has not caught up to that.
Mm-hmm.
But to go back to your question, I think more schools are looking at that. We're looking at holistic admission processes,
Mm-hmm.
trying to be more to attract more diverse student populations.
Right.
So as we do that, and then track those diverse student populations, our male populations, our different minority or underrepresented populations, I think that we're going to need more diverse faculty as well.
Mm-hmm. Absolutely.
I'm currently working on my college. We just developed a DEI task force to look at implementing more DEI programs, policy statement. How can we overall be more diverse and inclusive?
Yeah.
And a lot of that too starts with having some difficult conversations.
Mm-hmm.
We can go through these learning modules of what DEI is and how we should treat someone. But again, there's the implicit bias. There's micro and macro aggression happening in nursing education and institutions. I have experienced that myself. And now it's time for change.
Mm-hmm. Mm-hmm. Yep. Yeah, no, I think everything you said, and it makes me think of when we were speaking of the nurse navigator roles before, like you said, a task force at a hospital, because awareness is great and talking about it is great, but unless it actually enacts some kind of policy shifts and changes, the communities that you're trying to serve are still going to be like waiting around, like we're still here needing help, So yeah.
And even during this holistic admissions process, and we have become more diverse, I've even heard statements from faculty, well, now we're just letting anybody in. And that's not a fair statement to say.
Right.
Because if you're just looking at bringing everybody in with a 4.0, is that going to be your best nurse?
Mm-hmm. Right.
Me, myself, I applied to nursing school 3 times. I was denied the first 2 times, but I kept applying. But even after I got into nursing school, it was a struggle because I was a little bit behind the bar. I was a high school dropout. I had to get my GED. So that means I had to overstudy to keep up. I had to look up words in a dictionary to make sure I understood them to get through. And I remember writing my first paper, and the instructor called me out in front of the classroom about how bad my writing was.
Oh, jeez.
And I remember leaving that class and I just cried. And one of the nurses there, the nurse faculty, she was one of the few Black nursing instructors there. And she said, they just think we can't do it. We can't write. She said, but you need to not give up. You need to go to that teacher. Ask her to show you what you need to do. And then from there, I want you to write that paper over, and every time you have a question, you ask, make that extra effort. And I did it.
Yeah.
Because what I've also found that if you're not a nurse for the right reason, you're not going to want to do it. You're not going to love it. You're not going to invest in it.
Right. Yeah. I mean, give me a nursing student any day that is willing to do the work than one that comes in thinking they've aced all of their tests and they think they know what they're going to, they have expectations that are never going to be met because the real world, hospital world, does not look like the textbook utopia. And and
I don't discount anyone with that academic achievement. I mean, there are some 4.0 graduates, I give them higher praise. But I guess my point to that is that not every person coming in with a higher grade average is going to make the best nurse.
Exactly.
Because nursing is just not about the academics, like you said. It's about applying everything you learn into a real world setting.
Exactly.
And when you get into that hospital, it's a different impact. It's a different eye-opening experience.
Right.
You have to apply that learning and also some creativity and innovation yourself.
Yes.
And caring for your patient.
Yep. Yeah. I mean, you have to sort of, I hate to say get a thick skin, but if you come into the nursing profession already have overcome a lot of personal struggles, you're probably going to do a little bit better starting out, because it's terrifying for every new nurse. You know, you don't want to make a mistake. You don't want to
Mhm.
look like an idiot in front of these other seasoned nurses.
Or the
But
doctors.
yeah, right. or the anybody.
Yes, I
Patient.
had a doctor who told me my first day. I was giving him a report on one of his patients. He told me, he said, "You must be new. Just give me somebody that know what they're doing."
Oh,
And I was so hurt, but that was my
yeah.
first lesson in being,
Yes.
having tough skin. And I
Yep.
said, "Well, I'm sorry, doctor, nobody's available, but I'm going to do my best to give you the information you need."
Right.
And he was not happy on that phone, but
Yeah. But oh well. Let's talk about community.
Mhm.
We are huge community advocates at NurseDec. I mean, that's our entire premise for our organization. Um, I had an amazing conversation with Dr. Danielle McCamey. I think you know her as also being the
Yes.
co-chair of DNPs of Color. And we talked a ton about community and having communities where nurses feel safe in, and having a safe space to talk about not just their nursing experience, but everything that's going on right now. Um, how do you think that the communities that you're a part of, or Nurse Deck, can be better advocates to bring nurses together?
I think that these communities for me are one exceptional because it allows us to have a voice.
Hmm.
It allows us to have a place where we can meet people just like us,
Yes.
support each other, educate each other, because every day is an opportunity to teach and learn
Yeah.
something. I think having people there that can mentor us and just
Hmm.
learn about what's happening in the world for nurses today.
Right.
I get inspired because I see nurses excelling as
Yeah.
leaders, as entrepreneurs, and
Yes.
that inspires me. Okay, Angel, what do you want to do next?
Right.
But I do think having a community of that support, the collegiality
Hmm.
that brings us together is why I love, DNPs of Color and Nurse Deck,
Hmm.
because it's a place for us to shine and
Yeah.
have our voices heard and
Yeah.
also just
Yeah.
share
Yeah.
experiences.
Yeah, absolutely. I think there's a certain kind of alchemy that happens when people just get in a room together that can all relate to one another, and you don't have to give background on yourself. You just know,
Yes,
and
yes,
that
we can
is,
relate to each
yes.
other and we can be there and just, at the DNP of Color conference. I mean, I was in awe of
Yeah.
all the different types of nurses that I met through that conference, the different roles that they play, and all of these nurses in the community that I did not know
Right.
existed.
Yeah.
So I'm learning so much from so many different communities and platforms that I think
Right.
is remarkable to have the support
Right.
and strength of these communities available to us.
Absolutely. Well, I think this is a good place to wrap up here. Is there any topics that we haven't mentioned that you wanted to speak about, or any organizations that you want to point out for? I know we talked about DNPs of Color, um, that our listeners and viewers should be aware of. Um, I love that you talked about the nurse navigator role and the different ways that nurses can be used as task forces. I picture nurses as like this rising tide of an army right now. I hope they're out there feeling this way, because we so
Yes,
need it.
yes.
Um,
And I want them to feel that way. I want them to know that they are this rising, this army of caregivers
yeah,
and leaders and
yes,
mentors. We are a strong group of heroes.
hmm,
And I'm proud to be a part of that group.
yeah, same. Well, I don't know if you've had a chance to poke around on our site at all. We have our kind of main mothership site, and then we have this offshoot that's brand new. That's our Nurse Deck Social. So if
Mhm.
you haven't poked around on there, I would love to extend a personal invitation to be a part of that. We have all different little groups that are being created in there, and I've loved having your voice added to our mix today. So just thank you so much for your time and all the work that you're doing. And I think that's about it for me today.
Well, thank you for this opportunity to allow me to share my experience, my story, to have my voice heard as well. And yes, I am on the Nurse Deck
Great.
social. I received messages, hey, you're being followed. And I was like, oh,
Yeah.
who's following me?
Yep.
So I am honored. I'm very humbly honored to be here today with you.
Awesome. Well, thank you so much, Angel. It was great talking to you. And we will be in touch and let you know.
Thank you again,
All
Brianna. Nice
right.
to meet you.
Awesome. Very
Bye
nice to meet you. Thanks.
bye.